Hi, I'm Dr. Samuel Bederman. I'm an orthopedic spine surgeon here at Restore Orthopedics and Spine Center. My practice focuses specifically on spine surgery, both adults and kids. I do have a special interest in scoliosis and spinal deformities and curvatures, and I've been in practice here for about 10 or 15 years. So treatment options for adolescent scoliosis, that is scoliosis in teenagers, has been relatively limited over the years to include things like just keeping an eye on it, we call observation, bracing, depending on the size of the curve and how much growth is remaining, to surgery. And traditionally, surgery has been primarily fusions, meaning straightening the spine but locking all of the individual bones together. That was really before the onset of more motion-preserving techniques such as ApiFix. ApiFix is really a new, novel technique in the field of scoliosis treatment. It involves correction of the spine, but maintaining mobility and motion through the segments. And so it gives us the benefit of correction without the drawback of stiffening the spine or fusing the spine. I think patients that might be candidate for ApiFix are the ones that have a single curve, where the curve is a sufficient magnitude, whether it's 35, 40 degrees or more. And generally, these are either children or young adults that have a sufficient amount of flexibility. And even without a bending x-ray to determine exactly what that size of the curve is, you can get a sense of how flexible one is. I think that the benefit is greater in the lumbar curves, in the lanky fives, rather than the thoracic, because I think the mobility is much more important in the lumbar spine. The difference between leaving some flexibility in the thoracic spine versus a complete fusion of the thoracic spine is probably not that big of a difference. Whereas I think in the lumbar spine, it's really critical. Danica came to me because she was complaining of back pain and a progressing curve in her lower back. And she happened to be a person who had a lot of flexibility. And so in order to correct that curvature in her spine, the traditional techniques would involve fusing it, which would put a lot of stress on other levels above and below, particularly because of her flexibility. In order to balance out correction of her curve with maintaining flexibility throughout the majority of the spine and avoiding stress on other levels, ApiFix became a very good option for her. Every patient has some fear of surgery. And that's true whether the surgery is a fusion or whether the surgery involves preserving some motion. And so that exists regardless of what the options are. In her case, we had the option of doing something less than what would be traditionally considered a conventional treatment. And so while there are risks to all surgery, of course, this seemed like a better option. It involved less extensive surgery, quicker recovery, and her ability to bounce back a lot faster. Well, we saw a tremendous response to her surgery. So she went from a 40-degree curve down to about 20 degrees, so about 50% improvement in her curve. Maintaining flexibility, she was able to recover very, very quickly. She really had little pain, and she was able to return to her normal activities. What surprised me most about ApiFix compared to fusion surgery was the recovery period. After fusions, I'm typically used to having people stay in a brace for a period of 6 weeks and then starting some physical therapy for their post-operative recovery. What I've learned about ApiFix is that the recovery period really shortens down. So we only limit them for about a week or two in terms of excessive activities, and then we get them in to therapy and get them moving right away. Compared to conventional fusion surgery, which is done in a similar fashion through the back, where we know there are certain complications such as failure of the fusion to take place that could result in failure of the hardware, breakage of the hardware or loosening, or developing other problems, degeneration of levels above and below, those are problems that could be anticipated with ApiFix too. One of the nice things about ApiFix is if there is some complication or breakage of the instrumentation, removing it is really not that different from removing the instrumentation that we're used to. And converting it to a fusion may be required if there is a mechanical failure, but on the other hand, prior to ApiFix, they would have had the fusion to begin with. Well, I think for those who are considering ApiFix as a possible tool to use for adolescent scoliosis, it's really quite similar to conventional screw rod surgery. The only difference is there is some specifications to screw placement. The rod obviously has some differences because there's a mechanical device compared to a conventional rod. But apart from that, putting in screws and putting in rods is pretty similar to what we do on a day-to-day basis. I think the main advantages of ApiFix are that it limits the degree and the invasiveness of the surgery so the recovery is faster, and it maintains the flexibility. Hopefully we'll see fewer problems arise relative to degeneration or wearing out of other levels. Flexibility improves. I would say those are the real advantages.